Welcome back to Afternoon Live. May is National Pet Cancer Awareness Month, and even though you don't want to think about your pet ever getting sick, it is best to be informed. Here with more, we welcome back our friend, Veterinarian Dr. Cherice Roth. It's always so good to see you.
Good to see you too.
It is hard to imagine, but we do have to be ready so we can best help our pet if they have to go through this.
It's so true, and I think the best part about it is you're not helpless.
There you go.
There are so many things that you can do to nip it in the bud early, detect it early, even maybe before there is even actually cancer there. And then once cancer is there, there are so many options that we have now that we just didn't have before.
That's true. Okay, don't go in with fear. We have so many options. So beginning with understanding some warning signs, what are some things to look out for?
Yeah, so the easiest for us to see is lumps and bumps, right? And so I have very basic rules about lumps and bumps. If it changes in size, shape, or color, I need to see it. I need to biopsy it. If it bothers the pet, suddenly they're licking in that spot or chewing that area, or if you find it that it's bothering you. So changes in size, shape, or color, bothering the pet, bothering you, it's gonna bother me. Let's investigate it.
Okay, those are good places to start.
Yeah. Outside of that, you really, the goal here is to be proactive. If you know that you have a breed that is predisposed to certain types of cancers, do monthly lump and bump checks. And that's as easy as sitting on the couch or on the floor if you have a really big dog that thinks they're a lap dog, and just feeling them. And searching. It doesn't have to be a big production, just really being on top of those. For the internals, this is where you really have to be a really great partner with your veterinary team, because there are things that we can do, especially for breeds that are predisposed. Chest x-rays to check for things that are happening in the lungs, abdominal ultrasounds, and blood work are great ways for us to be like, ooh, maybe something is happening here that we need to investigate further.
Well, and brings back the importance of just those regular wellness exams.
Absolutely.
On a regular schedule.
Yes, as younger, we say once a year, but as they get into senior pets, I really want to see them at a minimum twice a year.
Well, you mentioned some different things we can do in terms of screenings. There just are so many options now.
Yeah, there are great options. There are actual blood tests now that can help us detect bladder cancers and those sorts of things, lymphomas that we didn't really have before, that we can now use as a tool to detect them even earlier, before signs even start sometimes.
That's incredible.
Right? Like that's what we want.
The best gift that you can give your pet at that point.
And
then what about behavior changes? Those can be alarming too.
Yeah, especially for internal cancers, or like I said, kind of starting to lick and chew at a bump that has been there for a while, are absolutely great indicators. But for internal cancers, you can look for things like lethargy. It's not the same thing as in humans. This is, wow, they're really not getting up to greet me. They don't want to go run and chase the ball anymore. They're not feeling like themselves. And you hear me say this all the time, but I always drive this home. I'm a pet expert. You are the expert on your pet. And so if you come to me and say, I don't know, Dr. Roth, he's just not himself. We're going to investigate that. Absolutely.
And then you mentioned as well, other specific breed risks, and then healthy weight. That is so important across the board for so many different things.
For so many things. But yes, pets that are obese are actually predisposed to cancers. And some of it is, it's harder, frankly, for us to find skin lumps and bumps if they're encapsulated in fat. Like as hard as that sounds, that the more svelte they are, the easier it is for us to find those little lumps and bumps and to get an accurate biopsy of it. Because there are sometimes I'm looking for lumps and I get a sample of fat. And then it makes it seem like there's nothing going on when there certainly could be something serious. But even outside of that, really predisposes them to increased inflammation, which we also know is an indicator to increased chances for cancer.
Well, and a lot of especially older pets, they do develop those very benign lumps and bumps, and maybe they look a certain way for several years, but then one day you do notice something different.
Yeah, and so cancer is very tricky, right? Because this is literally one cell, usually, that just goes, I'm not going to abide by any of those rules. I'm just going to do my own thing and just grow out of control. And so there are some that are benign, meaning that we're not expecting them to spread to another organ and cause a fatality. But then there are some that are benign but are malignant by location. And so what that means is that if it's in a spot that if it gets so big that I can't take it out, even if it's benign, even if it's not going to spread, if we waited too long, I can't do anything about it. And so there's benign, there's malignant, and then there's malignant by location.
Yeah. That makes sense.
Yeah.
What about comfort and dignity for the pet if you do get kind of a scary diagnosis and moving forward and working with your vet?
Yeah, so we are experts on quality of life, right? And so that is something that is huge. One of the things that I will say particularly about this is that chemotherapy, radiation treatments, those things like that look so much different in pets than it does in people.
Sure.
And so sometimes hearing that a pet needs chemotherapy or something like that can be triggering based on something that you've experienced in yourself or in a family member, but really hear the doctor out because it doesn't necessarily mean all their hair is going to fall out. It doesn't necessarily mean that they're going to be vomiting and diarrhea. It can look very different based on the type of cancer and the type of medications that they're using.
That is so fascinating.
Yeah.
So what are some things that like a dog might experience going through that kind of treatment?
Intense boredom.
That makes sense.
Yeah, like most of the time, like if it is an infusion, they have to sit there and be the bestest boy or the bestest girl for some time. And so sometimes we'll give a mild sedation or those sorts of things during the infusions. But by and large, after that, they go home. And because their fur grows differently than our hair, most of the time they're not going to have that intense hair loss depending on the medications and the breed of pet.
Okay. Well, and above all else, never be afraid to reach out and ask because you've seen it all.
That's it. You know, the thing is thankfully science has come so far, not just for humans, but for our furry, scaled, and feathered counterparts, right? And the reality of it is that even something that was a death sentence last year is no longer a death sentence this year. We have interventional radiology, chemotherapies, surgical interventions that really do change year to year because of that intense scientific research to help our critters live longer and better lives.
That's amazing and great news for all of us.
Yeah, we're not helpless.
Exactly.
It's hard.
Yeah.
And we're not helpless.
We're going to get it all done together.
We will.
Thank you so much.
My pleasure.
It's always nice to see you.
You too.
Okay, we will have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.